Many cities have needle exchange centers, but La Crosse seems to be unique in the state with how many discarded needles are found in the community. The Heroin and Illicit Drugs Task Force is considering a new way to make sure syringes stay off the streets. News 8's Madeline O'Neill is here now with a look at what they're proposing.
Mike, a subcommittee of the Drug Task Force is looking to purchase 2 Sharps drop box containers to put in public, one on the north side of La Crosse and one on the south side. They say it's important to make sure properly discarding needles is the easy choice.
It doesn't matter what the needles are being used for. The point is that there are needles in the community that we don't want there.
Whether or not the discarded needles are coming from the needle exchange program from La Crosse's AIDS Resource Center, it's clear something needs to be done.
I'm pretty familiar with a lot of the, needle usage activities that take place across the state, and La Crosse definitely is the one that comes to mind with the most issues related to improperly discarded syringes.
The Heroin and Other Illicit Drugs Task Force wants to add Sharps drop-off boxes to public places, somewhere on the north side and the south side.
And this should help alleviate, one, some of the needles that would be found in public, and two, the number of needles and the calls that non-emergency dispatch gets, and then the fire department would have to run out and pick them up.
Both medical and drug needles could be dropped off in the boxes, which cost about $1,000 and would be the size of a mailbox.
We need to make sure that they're secure, that they can't be removed, that they can't be damaged in the way that would cause hazard to the people that are either disposing in the drop box or are picking up the needles from the drop box.
Committee members are speaking with other communities that already have public Sharps drop-off boxes, like Jackson County, where there are 2.
We wanted to offer a safe option for where to put them, and we know that sometimes it's hard to find a safe place to put them. It's really worked out well for our community.
Health officials say making needle disposal easier is part of the solution to a not-so-easy problem.
Just adds one more opportunity to make it easy for people to dispose of needles properly.
Members of the Drug Task Force say we could see the Sharps containers as early as the end of January or early February.
Thanks a lot, Madeline. The committee is still looking into the possibility of creating a volunteer needle pickup program.